When you've decided your family is complete, the conversation often turns to permanent birth control. It's a significant decision. Understanding the options is crucial for making an informed choice that feels right for you and your partner. But when it comes to permanent sterilization, which path is medically safer, simpler, and more effective? Today, we're diving deep into the comparison between male and female sterilization procedures, vasectomy and tubal ligation. We'll look at everything from the surgical risks and what the procedures actually involve, to recovery times and long-term effectiveness. This isn't about deciding for you, but about equipping you with the knowledge to have a productive conversation with your partner and your healthcare provider. Let's start with male sterilization, the vasectomy. A vasectomy is a minor surgical procedure designed to block sperm from reaching the semen. The procedure targets the vas deferens, which are the two small tubes that carry sperm from the testicles to the urethra. During a vasectomy, a doctor will typically make one or two very small incisions or a single tiny puncture in the scrotum. Through this opening, the vas deferens are located, cut, and then sealed. This can be done by tying them, cauterizing sealing with heat, or using surgical clips. The entire process is usually very quick, often taking less than 30 minutes to complete. It's typically performed in a doctor's office or an outpatient clinic under local anesthesia, meaning the patient is awake but the area is completely numb, so they don't feel any pain. Because the incisions are so small, stitches may not even be necessary. The goal is simple: create a permanent barrier so that sperm can no longer be part of the ejaculate. It's important to note that a vasectomy does not affect testosterone production, sex drive, or the ability to have an erection or orgasm. Now let's turn our attention to female sterilization, most commonly known as tubal ligation, or getting your tubes tied. This procedure is designed to prevent an egg from traveling from the ovaries through the fallopian tubes, where fertilization by sperm typically occurs. A tubal ligation is a more involved surgical procedure compared to a vasectomy. It blocks or seals the fallopian tubes, creating a permanent barrier between the egg and sperm. There are several ways a surgeon can perform this procedure. Common methods include laparoscopy, where a surgeon makes small incisions in the abdomen and uses a thin, lighted tube, called a laparoscope, to see and access the fallopian tubes. The tubes can then be cut, tied, clipped with small bands or clips, or sealed using an electric current. Another approach, often performed right after childbirth, is a mini laparotomy, which involves a slightly larger incision near the navel or just above the pubic hairline, because it's more invasive. Tubal ligation is usually performed in a hospital or surgical center. It typically requires general anesthesia, meaning the patient is asleep during the entire procedure, or regional anesthesia, like an epidural, which numbs the lower half of the body. The procedure itself can take around 30 minutes, but the overall process, including anesthesia and initial recovery, is longer. When we compare the surgical risks, there's a clear difference between the two procedures. Vasectomy is considered a very low-risk surgery. The most common complications are minor and localized, such as swelling, bruising, or mild pain at the incision site. Infection is possible, as with any surgical procedure, but it's rare. A small percentage of individuals might experience a collection of blood in the scrotum called a hematoma, or a small lump known as a sperm granuloma, which is sperm leaking from the cut tube. More persistent discomfort is very uncommon, because it's performed under local anesthesia. Vasectomy avoids the risks associated with general anesthesia, which can include nausea, allergic reactions, and, in very rare cases, more serious complications involving breathing or heart function. The procedure is less invasive, which inherently reduces the potential for surgical complications. On the other hand, tubal ligation, being an intra-abdominal surgery, carries a higher level of risk. While it is still a very safe procedure for most people, the potential for complications is greater than with a vasectomy. Risks include those associated with any major surgery, such as bleeding, infection, or a negative reaction to the general anesthesia. Because the surgeon is working inside the abdominal cavity, there's a small but real risk of injury to nearby organs like the bladder, intestines, or major blood vessels. These complications are not common, but their possibility makes tubal ligation a medically more complex and riskier procedure overall. The invasiveness of the surgery itself is the primary driver of this increased risk profile. Recovery time is another major point of difference. After a vasectomy, recovery is typically very quick. Most people are advised to rest for a day or two and avoid strenuous activity or heavy lifting for about a week. Mild discomfort, swelling, and bruising can be managed with ice packs and over-the-counter pain relievers. Many individuals feel well enough to return to a desk job within 2 to 3 days, though they should follow their doctor's specific advice. Sexual activity can usually be resumed in about a week, but it's critical to remember that a vasectomy is not effective immediately. It takes time and several ejaculations for the remaining sperm to be cleared from the vas deferens. A follow-up semen analysis is required, usually after about 3 months, to confirm that the semen is sperm-free. Until a doctor gives the all clear, another form of birth control must be used to prevent an unintended pregnancy. Recovery from a tubal ligation is significantly longer and more involved. Since it's a more invasive surgery, often performed under general anesthesia, patients need more time to recuperate. After the procedure, it's common to experience abdominal pain, cramping, bloating, and fatigue. Pain at the incision sites is also expected. Most people will need to take about 1 to 2 weeks off from work and avoid heavy lifting or vigorous exercise for several weeks. The recovery period can vary, depending on the specific surgical method used and the individual's overall health. Unlike a vasectomy, a tubal ligation is effective immediately, so there is no waiting period required before it can be relied upon for birth control. Finally, let's talk about effectiveness and failure rates. Both vasectomy and tubal ligation are considered highly effective forms of permanent birth control, but one has a slight edge. A vasectomy is one of the most effective methods of birth control available. The failure rate is extremely low, with studies showing that the chance of pregnancy after a man's vasectomy is confirmed to be successful is about 1 in 2,000. Most failures occur in the first few months after the procedure, usually because a couple did not wait for the semen analysis to confirm there were no sperm left. Or in very rare cases, because the cut ends of the vas deferens managed to grow back together, a process called recanalization. Tubal ligation is also highly effective, but its failure rate is slightly higher than that of a vasectomy. The chance of pregnancy after a tubal ligation is estimated to be about 1 in 200. Failures can happen if the tubes were not completely blocked during the surgery, or if they spontaneously heal and create a new opening over time. A concerning aspect of pregnancy after tubal ligation is the increased risk of an ectopic pregnancy, where the fertilized egg implants outside the uterus, usually in the fallopian tube, which is a serious medical emergency. So when you put it all together, the picture becomes quite clear. Vasectomy is a simpler, safer, and less invasive procedure with a shorter recovery time and a lower failure rate compared to tubal ligation. From a purely medical standpoint, it carries fewer risks, involves less discomfort, and is statistically more effective. It's performed in an office setting under local anesthesia, allowing for a swift return to daily life. Tubal ligation, while a very good and reliable option for permanent birth control, is a more significant surgical undertaking. Requires a hospital setting, general anesthesia, involves intra-abdominal surgery, and necessitates a longer and more uncomfortable recovery period. The decision of who gets sterilized is a personal one for every couple, and it involves more than just medical facts. There are personal feelings, relationship dynamics, and individual comfort levels to consider. But understanding these key differences in safety, recovery, and effectiveness is a vital first step. This knowledge can help you and your partner make a collaborative and well-informed decision that aligns with your health and family planning goals. For more insightful discussions on reproductive health and relationships, be sure to subscribe to our channel, Sex Education Report.